Since the beginning of the COVID-19 pandemic, practitioners and patients have increasingly turned to telehealth, which is the use of telecommunications technology to provide healthcare to patients in a different physical location. This has transformed the delivery of healthcare, particularly by increasing access for those in underserved geographic areas and those who face other barriers in accessing in-person services. The Uniform Telehealth Act, which resulted from a multi-year collaborative and nonpartisan drafting process, provides a framework for the delivery of telehealth services. It has two broad goals. The first goal is to make clear that a practitioner who is licensed or otherwise authorized to provide health care in the state in which a patient is located may provide care to that patient through telehealth, if doing so is consistent with the applicable professional practice standards and the practitioner's scope of practice as defined by the patient's state.
The second goal is to expand the circumstances under which qualified out-of-state practitioners are permitted to deliver telehealth services to patients located in the enacting state. The Uniform Telehealth Act opens state borders, allowing practitioners to assist patients in a more convenient and potentially more cost-effective manner. For example, the Uniform Telehealth Act permits a patient's physician to provide follow-up care via telehealth when a patient is traveling in the enacting state. The Act also establishes a system through which physicians and other practitioners licensed in another state can obtain authorization to deliver telehealth services in the enacting state. This way, the enacting state has a registry of authorized out-of-state practitioners and may monitor and discipline them if appropriate. The Uniform Telehealth Act is a powerful tool for healthcare equity, facilitating widespread access to timely and effective healthcare. So many patients face barriers in obtaining in-person care. Patients may live in rural areas, lack access to transportation, have limited mobility, or might be embarrassed or anxious about seeking care, or they may simply be busy taking care of their day-to-day obligations. By establishing a framework for the delivery of telehealth services, the Uniform Telehealth Act helps these patients obtain care from a qualified practitioner, no matter where they are located.